Myself, Dr. Ravikumar, consultant intensivist at Sagar Hospitals, Bangalore. Friends, all of us know that we are in the midst of a crisis called as COVID-19, wherein the patient mostly presents to the hospital with mild symptoms, and if it is severe symptoms, the patient will end up in the ICU. Ours being a developing country, and our healthcare facilities are very scarce as of today. As all of us know, if the patient develops acute respiratory distress syndrome due to COVID, and if he has to be treated in the intensive care, he will require a ventilator. But as we also know that the ratio of the ventilators to the beds we have in India, it's a big factor, big limiting factor, and that should not be the reason for not treating the patient. Actually, we can ventilate up to 4 or 5, and if you have the good, if you reduce the dead space, you can go on ventilating up to 5 or 6 patients, up to 7 also. But to make this simpler equipment and to decrease the dead space, I am just going to talk about splitting one ventilator among the 2 patients. Here we use one ventilator, 2 ventilator circuits, 2 HMB filters and 2 viral filters, and 4 Y connectors. One will be the blue color, which is indicated here, is the inflow to the patient, which is split here using a Y connector. This one goes to the patient number 1, another limb will go to the patient number 2. And here you can see at the patient number 1, which is represented by a check lung here. Yeah, and see here you have the T connector, where you have one is the inflow and the green color is indicated will be the outflow from the patient, which will be taken back to the ventilator. Similarly, on the other side, this is the indicates for the patient number 2, this check line which indicates for the patient number 2. Here also you can see that I've used a Y connector here, wherein the blue color is the inflow for the patient, the inspiration limb, and the green is the expiratory limb, which takes out the carbon dioxide. The most important thing is the hospital administration should approve the protocol before using it, because this protocol is only appropriate for consideration when crisis standards have been instituted. There are not enough ventilators to meet the demand for single patient ventilation, and multiple patients are present for whom invasive ventilation has a reasonable probability of saving life. Ethically, it must be considered that dual patient ventilation is not the usual standard of care. However, in the setting of a mass crisis such as the COVID-19 pandemic, the number of potentially rescuable patients may exceed the number of ventilators to support them. Thank you.